Good afternoon, good morning, good evening, whatever part of the world you're in. B Armor 479 right back at you. I said yesterday in my when we went to the county fair that I was going to do an update on a swine flu conference. This is a conference that I heard about. This describes it. They had a conference in Washington, D.C. The conference was on August 19th to the 20th. The workshop was on the 21st of 2009. This is on the recognizing the problems of the earlier of the response of what they're going to do on the swine flu outbreak. It's quite lengthy, so this video is going to be quite long. And you can Google this, just Google International Swine Flu Conference, and you can see it. It's a PDF file. It's on the internet, and you can get exactly what they talked about. The conference started out about meeting Dr. David Nabarro, I guess what you pronounce, United Nations Coordinator of the Human Influenza, the Animal Health Association, and the Pandemic Alert Response Team. And I'm reading this instead of looking at the camera off the computer screen, so forgive me for not looking at the computer screen. Topics include mass fatality management planning, county reports and situations updates, surveillance, and data management, preparing communities, strategies, and local partnership, and delivery of vaccine or antiviral medication, national pandemic influenza national countermeasures. Let's see here, impact on the hog/swine industry, benefit risk assessment, public health and industry and regulatory, prevention education, efforts of risk communication, command, control, and management, emergency response management, business-based planning, school-based planning, community-based planning. One of session ones was to develop and maintain plans and procedures and programs and systems, develop and training of exercise programs, direct fatality management, tactical operations. Now stop and think about that. Develop direct fatality management, tactical operations. Does that mean they're going to shoot us if we don't respond? That sort of worries me right there. Conduct morgue operations, manage data and conduct final distribution. The outbreak session 2 covered public distress and exposure and safety, outbreak of public services and utilities, medical supplies shortages, unwillingness to follow government orders. So the government will issue martial law. Well, I can tell you what I can tell the government. You can kiss my what? You know, you don't declare martial law. It's just a flu. The government's trying to scare the people. It's a bunch of BS, folks. Bunch of BS. And then it goes on to finding out the business risk and are insured. In other words, they want to find out whether you got insurance or not. Ensure safe travel during the pandemic. Identify and reduce even or close operations. In other words, the government can close your business if they want. that's going to be up to the government. Or up to this panel, I guess you might say. When 50% or more of the employees are sick, taking care of the sick ones, when H1N1 flu pandemic unfolds of 2 or 3 more consecutive waves in a calendar year, distributions to public and private critical instructive undermining of functions, emergency management services, and I will get you a photo shot of the next screen here, and here's the next screen. Next screen is a continuance. Mass fatality management planning. Mass fatality. Psychological issues, business and community planning, emergency management services, law enforcement agencies, first responders, fire departments, first responders, public works, 911 emergency center services, hospital and emergency medical services, workplace planning, school, university, pandemic planning, airlines, travel, airport, quarantine, and border health services, infectious medical wastes, and in agriculture, it would be next. The outbreak session 7 would be to protect the fire department and first responders from falling ill during these civil disturbances. They're thinking that the United States is going to revolt. That's basically what they're saying here. Continue to respond to the routine fire outbreaks while responding to pandemic-related calls. Efficiently transition into all-hazard incident management responders. Effective undertaking mass vaccinations. Enforce quarantines. In other words, they're going to enforce the quarantine law. First responders, public works. Protect the public workers, the first responders from falling ill and civil disturbance. Control traffic, evacuations, and mass transportation. Ensure the minimal delivery of clean water and sanitation services. Ensure stability of communications and networks. Overcome an overwhelming telecommunications network caused by a surge of telework employees, homebound calls, and increased surge of public services. 911 services. Effective range of 911 calls during this crisis. Developed a call of surge capacity. Surge call centers operations. Technical problems. Ensure that frequent, honest, and reliable information is released to the public. And then the outbreak session 10, hospital and emergency services. Prototypes the use of antiviral and workforce. Let's see here. Plan and reduce response capability due to the mechanical failure of lack of personnel. Maintain continuous operations during the pandemic. Plan to 30 to 40% of workforce droppage. 30 to 40% drop in workforce. Protect emergency operations. Workplace planning. Effective within 40% of less employees. Account for your employees. Establish remote offices, flexible work plans. Identify business and punctuations outsourced. Secure your workplaces. Train your workers to for symptoms and know what they look for. And here's the next screenshot here. I'll let you see it. And basically the rest of this goes on about current outbreak session 12, how it would be mandatory they can take your child from school and quarantine them in a place without your permission. That I would throw a fit for. It's just that's got a sign-up sheet. I tell you guys, you ought to Google that. Really, seriously, you ought to Google it. And it's a quite shocking thing that the government can step in and say, well, we're going to do this, and if you don't like it, tough shit. I'm sorry, folks. In my opinion, the government don't have any right to tell me that I have to take a flu shot, or if I have to take a swine flu shot, or my daughter has to take a swine flu shot. That's up to me and the higher power if that's what I wish. No one's going to tell me that my daughter has to take a flu shot. We don't know what this is going to do to our bodies in the future. Would it cause more disability in children? Would it cause them to be dumb, deaf and dumb? Would it be cause them to be blind? Would it cause what? You know, what would it cause? They don't know. 2 weeks of testing. Already, they've proved it that 25 people's already died of the flu vaccine. They've already proved it. But you don't hear the news on that bull. You don't hear the news on it at all. They're afraid to say it because they know that there's probably more than that that's dead on that, and they're afraid to tell the people. They're afraid to tell the people. Remember in 1976 when over 3,000 people died because they took the swine flu shot? That's just as many people died in a 9/11 attack. But you didn't hear nothing about that. No, it was covered up. So, government, if you're listening to this, come out and tell us the truth. Don't sit there and feed us a bunch of bull crap. Come out there and tell us the truth. You know, don't cover it underneath the rug like you do everything else. That's a bunch of bull. Guys, I swear, listen to Alex Jones' channel. Go look at his channel. He keeps us well informed over these such matters of the swine flu and about the New World Order. Guys, it's coming. This is part of it. Beware. Stay sharp. Don't fall to the BS. You know, just don't do it. Click on the commercials over there if you would. Later updates are coming. I thank each and every one of my new subscribers. I want to welcome you to my channel. I've got quite a few new subscribers. So take care. God bless each and every one of you. I do care about each and every one of you. I really do. Take care. God bless. Good night. Good night from America.